Good morning all. Today we are discussing about pulpotomy. Pulpotomy is the removal of coronal portion of the pulp. It's a conservative treatment modality of inflamed pulp tissue. Aim of pulpotomy is to preserve the radicular pulp and thus avoid pain and swelling and retain the tooth, thus preserve the arch integrity. Pulpotomy is defined as the complete removal of coronal portion of the dental pulp, followed by placement of a suitable dressing or medicament that will promote healing and preserve the vitality of the tooth. This definition is given by Finn in 1959. According to AAPD, pulpotomy involves the complete surgical removal of the coronal vital pulp tissue, followed by placement of a biologically acceptable material in the pulp chamber and restoration of the tooth. Objectives of pulpotomy are to remove the inflamed coronal portion of pulp, allow the pulp tissue in the root canal to remain vital, and maintain the tooth in dental arch. Rationales are: radicular pulp is healthy and capable of healing after surgical amputation of infected pulp, preserve the vitality of radicular pulp, and maintain the tooth in physiologic condition so that it can perform normal functioning. Coming to indications of pulpotomy, that is, the tooth should be free of irreversible pulpitis in spite of having a large caries lesion. The tooth is in a condition of irreversible pulpitis, that means the radicular pulp also involved. So in such cases, we cannot perform pulpotomy. And the tooth should not have spontaneous or persistent pain. Spontaneous as well as the persistent pain, that is, pain persists even after the removal of the stimulus, indicates irreversible pulpitis or the inflammation of the pulp is reached the radicular portion. So, the tooth selected for pulpotomy should not have spontaneous pain, and the tooth should be restorable, and at least 2/3 of the root length should be present for performing a pulpotomy procedure. There should not be any internal resorption or interradicular bone loss or presence of abscess. And the hemorrhage from the amputated site should be pale red in color, and the hemorrhage should be easily controllable. Coming to the contraindications, the persistent or spontaneous toothache, which indicates irreversible pulpitis, and if the root resorption happened and less than 1/3 of the root is remaining, or non-restorable tooth, or the hemorrhage from the amputated site is uncontrollable and dark red in color, and some medical histories like the patient, if the patient is having heart disease or the patient is immunocompromised or uncontrolled diabetes, in such cases, we cannot perform pulpotomy because the pulpotomized tooth can be act as a source of infection. And if there is any swelling or abscess formation or fistula, in such cases also we cannot perform pulpotomy. And if the tooth is having pathologic mobility or the tooth is with calcified canals, in all these cases are contraindicated for selecting as a pulpotomy procedure. Coming to classification, based on treatment objective, pulpotomy is classified into vital pulpotomy and non-vital pulpotomy. Vital pulpotomy is again divided into different techniques, that is devitalization pulpotomy, it also known as mummification or cauterization pulpotomy, then preservation pulpotomy, that is minimal devitalization and non-inductive type of pulpotomy, and regeneration pulpotomy, which is inductive or also known as reparative pulpotomy. Coming to non-vital pulpotomy techniques, that include use of beechwood cresol or formocresol. According to the extent of amputation of coronal pulp, it is divided into partial pulpotomy and complete pulpotomy. The partial pulpotomy is also known as Civics pulpotomy. The ideal pulpotomy material should be bactericidal, harmless to the pulp and surrounding tissue. It should promote healing of radicular pulp and preserve the radicular pulp without any clinical or radiographic symptoms. and it should not interfere with normal physiologic poop absorption. Coming to each technique of pulpotomy, Civics pulpotomy or partial pulpotomy is the removal of only outer layer of the coronal pulp. That is, the damaged superficial layer is removed. Usually, this procedure is indicated in young permanent dentition. The tooth is traumatically exposed, or the tooth with open apex, that is immature or incomplete root formation. In such cases, we can consider about partial pulpotomy. And it is considered to be a procedure that is staged between pulp capping and complete pulpotomy. Coming to the technique of Civics pulpotomy, first we have to give local anesthesia and place the rubber dam for isolation. We have to maintain proper infection control throughout the procedure. And after isolating the tooth using a rubber dam, a clean surgical field should be maintained, and we have to remove the carious part or traumatically exposed part, and a number 330 burr is used to enlarge the exposure site. And once deroofing is done, we should remove the superficial layer of pulp tissue, that is up to 1 to 3 mm depth into the coronal pulp chamber. Then continuous rinsing of the amputated pulp should be done, and this will help in hemostasis, achieving hemostasis. And after that, we have to give, once the hemostasis happens, we have to give a dressing of calcium hydroxide, and after that, do the filling using an MTA or glass amoxicillin. After this restoration of the tooth, we have to prepare for crown, and full coverage restoration should be given. And the follow-up should be done after 1 month and every 6 months. This radiographic evaluation of that particular tooth at regular intervals will show the formation of dentin ridge. The dentin ridge is evidenced radiographically after 6 to 8 weeks of the procedure. This diagrammatic representation of Civics pulpotomy. This you can see the placement of calcium hydroxide, and after that, formation of separative dentin in the third picture. Coming to complete pulpotomy technique, that is devitalizing, preservation technique, and regeneration technique. First, we will discuss about devitalizing pulpotomy. It is also known as mummification pulpotomy or cauterization pulpotomy. It can be performed in single visit or 2 visits. The single visit pulpotomy, the chemicals used or the agents used for pulpotomy are formocrosol, electrosurgery, or laser. In 2 sitting, we can use glycine paste, E6 formaldehyde, paraform, devitalizing paste. First, we will discuss about single sitting formocrosol pulpotomy. This is advocated by Sweet in 1930s. Actually, according to Sweet, pulpotomy is performed in multiple visits, but later on studies are conducted and it is limited to single or 2 visit pulpotomy. The medicament used, that is formocrosol, is available as Buckley's formocrosol. The composition contains cresol 35%, glycerin 15%, formaldehyde 19%, and remaining water, that is 31%. We use 1:5 concentration of Buckley's formula for pulpotomy. That is prepared by adding 3 parts of glycerin and 1 part of distilled water to 1 part of Buckley's formocrosol. Mechanism of action of formocrosol, that it inhibits autolytic changes in the tissue by binding to the proteins. coming to the procedure, first we need to anesthetize the tooth and isolate the tooth. Rubber dam isolation is preferred because a clean surgical area should be maintained throughout the procedure. And then we have to remove all the caries from the tooth. After removing the caries, sometimes pulp may be exposed by removing the caries, or else we can use burr. Number 330 or round burrs can be used to enter into the pulp chamber. And once the pulp chamber is opened, enlarge the exposed area and we have to completely remove the roof of the pulp chamber. And if there is any remaining caries on the walls of the tooth or any overhanging dentin ridge is present on the roof of the pulp, all things should be removed and complete deroofing of the pulp chamber should be done. And after that, we can use a sharp spoon excavator to scoop out the coronal pulp tissue. The pulp tissue should be completely removed from the amputated or from the orifice of the pulp canal. After that, irrigate the pulp chamber with saline and remove all the debris. After removing the debris, to obtain hemostasis, the wet cotton pellet is used to obtain hemostasis. Then remove the cotton pellet and then apply Buckley's formocrysol solution, that is taken in a small cotton pellet and damped in sterile cotton pellet to remove excess amount of Buckley's solution and place that cotton pellet inside the pulp chamber for 5 minutes. After 5 minutes, remove the cotton pellet and check for fixation. The fixed pulp tissue appears as brown in color, dark brown color. After that, place zinc oxide cement in pulp chamber. Recall after a week for permanent restoration, that is stainless steel cup. This is the procedure. First, isolate the tooth using rubber dam and then remove all the caries, expose the pulp and then completely deroof the pulp chamber. Remove the coronal portion of the pulp using a sharp spoon excavator and then achieve hemostasis. After that, place formocrysol solution, Buckley's formocrysol solution for 5 minutes and then remove it. The pulp stump should appear brownish in color after removal of the formocrysol damp water. Then place the restoration and the stainless steel crown should be done. If you're doing a histologic evaluation after 7 to 14 days of the radicular pulp, 3 distinct zones are identified. That is, the outer layer is broad acidophilic zone of fixation and then pale staining zone with fewer cells and then broad zone of inflammatory cells. Progressively, only the acidophilic zone of fixation is seen. For the other 2 zones are replaced with normal tissue. Coming to disadvantages of this formocrysol pulpotomy, it is caustic to tissues and high toxicity, and formocrysol is shown to be cytotoxic, mutagenic and carcinogenic in animal experiments. Other mummification procedures include laser pulpotomy and electrosurgery. Laser pulpotomy, where we are using laser, either carbon dioxide laser or argon laser or Nd:YAG laser can be used as a pulp. To cauterize the amputated pulp tissue. It's a non-pharmacological technique because no chemical is used to obtain hemostasis or or to fix the pulp tissue. After complete removal of the coronal pulp tissue, the laser is used in the frequency of 20 Hz. The laser radiation creates superficial zone of coagulation necrosis, and thus hemostasis is obtained. And pulp retains its vitality and it is capable of normal healing. The procedure is same as that in the initial procedure is same. We have to isolate, anesthetize the tooth and isolate the tooth, and then remove the caries and deroof the pulp chamber, remove the coronal portion of the pulp using the spoon excavator, and then apply laser, and after that restoration. Advantages of laser includes immediate attainment of hemostasis and preservation of vital tissue near the root apex, and absence of any odor or taste that may lead to more satisfaction to the children and parents. Next method is electrosurgical pulpotomy or electrosurgery. A US dentist, named Mark, is the one who performed electrosurgical pulpotomy, that is in 1993. The procedure is same as initially, that is, we have to isolate the anesthetize the tooth, isolate the tooth, and then remove all the caries. After that, deroof the pulp chamber, remove the coronal portion of the pulp. Then dental electrode is used for giving electric arc. That electrode is placed 1 to 2 mm above the pulpal stem, that is at the root canal orifice. Then electric arc is allowed to bridge the gap of the pulp stem for 1 second, then stop for 5 seconds and repeat the procedure. That cool down period is 5 seconds. And repeat the again, current is passing for 1 second and then cool down period is 5 seconds. And if properly done, the pulp stem appears dry and completely blackened. That means hemostasis is obtained, and then fill the chamber with zinc oxide eugenol and restore with stainless steel crown. Advantages include self-limiting pulpal penetration. That is, only few layers of pulp is mummified. There's good visualization of hemostasis, and there is no use of any chemicals such as formocrysol, and spending less chairside time than the formocrysol pulpotomy. It has got the disadvantages that the contaminated pulp tissue may not pass the electric current, so effective hemostasis we cannot attain. That is one disadvantage of electric pulpotomy. Then coming to two-visit pulpotomy, it's a two-stage procedure. It involves the use of medicaments such as diacetylthiopaste or Civics formaldehyde, etc. The composition of diacetylthiopaste contains tricrysol, cresol, glycerin, paraformaldehyde, and zinc oxide. Civics formaldehyde paste contains paraformaldehyde, procaine base, powdered asbestos, petroleum jelly, and caramel. Paraform devitalizing paste is constituted with paraformaldehyde, lignocaine, propylene glycol, carbowax, and caramel. Indications of two-stage pulpotomy is inability to arrest the hemorrhage from amputated pulp stems during single-visit formocrysol pulpotomy, and in case of if the child or the patient is uncooperative. So in first visit, we have to isolate the tooth under rubber dam and prepare the cavity, excavate all deep caries lesion or all soft or infected dentin. And when pulp is exposed during excavation, clear the exposed site and enlarge the exposed site using a round burr. Then incorporate paraformaldehyde paste into a cotton pellet. The size of the cotton pellet should be such that it should completely cover the exposure site. And then seal the cavity with a mix of zinc oxide eugenol and leave for 1 or 2 weeks. This formaldehyde gas liberated from the paraformaldehyde paste penetrates through the coronal pulp and it will fix the radicular tissue. In second visit, proper pulpotomy procedure that is carried out using LA. And then remove the zinc oxide eugenol dressing and remove the cotton pellet. After that, deroof the pulp chamber, or the roof of the pulp chamber is removed. Then clean with saline, dry with a cotton pellet, and pulp chamber is filled with antiseptic paste and restore. That is 2-visit pulpotomy. Coming to next method of pulpotomy, that is preservation pulpotomy. It is also known as minimal devitalization or non-inductive pulpotomy. So as the name suggests, it preserves or maintains maximum vital tissue. But there is no induction of odontoblast and formation of reparative dentine. The materials used in preservation pulpotomy are glutaraldehyde and ferric sulfate. Glutaraldehyde pulpotomy is first proposed by Graham-May and it is first used by Opel. The glutaraldehyde got several advantages over formoprazole, that are superior fixative properties, excellent antimicrobial, it is less toxic because the glutaraldehyde got a larger molecular size compared to formoprazole. So it won't penetrate into the deeper tissue layer. Then it causes less necrosis, low systemic distribution, non-mutagenic, and low tissue binding so that it is easily excreted. And it requires less time for fixation. Then coming to the next chemical that is used for preservation technique is ferric sulfate. It's an astringent. It's not a fixative chemical. It is an astringent. Astringent means the material which is used for control of bleeding. The ferric ions from the ferric sulfate bind with the pulpal proteins and form a metal protein complex, which mechanically occlude the capillary vessels, thus prevent thus stop the bleeding. That is how it is attaining hemostasis. It's causing less inflammation and it is available in 15.5% solution as an astringent. And the technique is similar to conventional pulpotomy method. The same thing for all these preservative, even the procedure is same until the deroofing of the pulp chamber and removal of the coronal pulp tissue using the spoon excavator. And then apply this ferric sulfate for 10 to 15 seconds, which will give hemostasis, and then you can restore the tooth. There is no concerns about toxicity or tissue toxicity or carcinogenicity or mutagenicity regarding ferric sulfate. Coming to regenerative pulpotomy, it's also known as reparative pulpotomy or inductive pulpotomy because the materials used stimulates the formation of a dentin ridge, or it stimulates the odontoblast, radicular odontoblast to form dentin, that is reparative dentin. The materials used for regenerative pulpotomy are calcium hydroxide, bone morphogenic proteins, MTA, or enriched collagen, freeze-dried bone, osteogenic protein, bioactive glass, and stem cells. In this calcium hydroxide is usually not used in case of primary tooth. Why? Because this calcium hydroxide in primary teeth dental pulp is more cellular, and there is chance of developing or differentiating odontoclast, and that can cause internal resorption. So calcium hydroxide pulpotomy is not commonly practiced in case of primary tooth. Coming to non-vital pulpotomy or mortal pulpotomy. Initially, I told that pulpotomy is done in a vital tooth. But here, in some cases, we can perform non-vital pulpotomy, that is also known as mortal pulpotomy. The ideal treatment option of that particular tooth where we are performing non-vital or mortal pulpotomy is pulpectomy. That is complete removal of both coronal and radicular pulp and restore with obturate with a proper obturating material in radicular portion and then restoration. But in some cases, like if the canal is non-negotiable or the patient cooperation is very limited, in such cases, we can perform or we can consider about mortal pulpotomy. Technique includes in first visit, the necrotic coronal pulp is removed using burr or spoon excavator. And then pulp chamber is irrigated with saline and dried with cotton pellet. Then infected radicular pulp is treated with a strong antiseptic solution like beechwood cresol or permocresol. Then seal the cavity with temporary cement for 1 to 2 weeks. Initially, we have to remove all the caries and then open the pulp chamber and remove the coronal tissue, necrotic tissue, and then place an antiseptic, that is beechwood cresol, and seal the cavity for 1 to 2 weeks. In second visit, again isolate the tooth, remove the temporary restoration. If symptoms persist, that is bleeding or pain, or the tooth is again, the pulpal tissue is vital, in such cases, we can repeat the first visit procedure for 1 more week, or we can consider about extraction. If asymptomatic, in second visit, the pulp chamber is filled with antiseptic paste and we can press this cement into antiseptic paste into root canals using cotton pellets, and then tooth can be restored with a stainless steel cup. Then what are the failures that can happen after vital pulp therapy? There can be cause of internal resorption or presence of abscess or pain, and another failure is pulp canal obliteration. So these are all about pulpotomy. Pulpotomy is a vital treatment of conservative treatment of inflamed pulp. It includes several techniques. Can be single visit or multi-visit. It can be partial pulpotomy or complete pulpotomy, depending upon the technique. We can maintain the radicular pulp vitality and thus preserve the tooth in the arch, thus preserve the arch integrity. Thank you.